This is Linda. The only thing she loves more than haircuts is going to the gym, but recently, Linda's noticed that she gets short of breath more frequently than usual and is always feeling tired. So she books an appointment with her GP, and he thinks it's best she gets a blood test, suspecting anemia. After it's been taken, it is transported to a pathology lab where it will be tested. And depending on the test that needs to take place, the sample will undergo multiple treatments and procedures. In Linda's case, the sample will undergo a complete blood count, as this is the diagnostic tool for anemia. After this, the results will be communicated to Linda's GP in order for the problem to be resolved. As her anemia is treatable, with the help of a few ferrous sulfate tablets, she's back at the gym in no time. Linda is buzzing. But the process of diagnosis is not always this smooth.
Linda's story is a best-case scenario, but many points throughout the screening process are susceptible to human error. First of all, Linda's blood sample is collected. Currently, this involves blood being dispensed into a coloured sample bottle, indicating what test is taking place with a handwritten paper label displaying information of the patient. This can cause problems regarding identification. If the sample spills, damaging the label, or if handwriting smudges or is difficult to read, samples can be wrongly identified. Once they're collected, her sample is transported to a sample testing centre or pathology lab, where problems will be identified. Presently, sample collection services are fragmented, meaning that a patient's sample may take long periods of time before being processed. Plus, samples may be tested at labs not local to patients, reducing efficacy and cost. In addition to this, logistical support for transport of samples is lacking. Following on to this, along the journey there are multiple opportunities for the sample to be lost or misplaced. The next step in the journey is receipt. Once the sample has arrived at the lab, there are many opportunities for mishaps. For example, a sample could get lost in the testing facility itself due to inaccuracy on the label or contamination risks due to samples being passed from person to person. Investigation is the penultimate and largest place for errors to occur. Currently, there are large inconsistencies between localities in regards to baseline figures and procedures and conduct when testing samples. This can lead not only to inconsistency in standard test results, but variability from test center to test center because of the unpredictability in testing. Some could say that this lack of unification of thoughts is undermining the patient-centered methodology of the NHS as a whole. And finally, reporting the results back to patients. The lack of end-to-end IT connectivity limits both order communications and diagnostic decisions, causing for many retests to be conducted unnecessarily with a larger yield of results than needed, wasting not only NHS funds, but the precious time of biomedical scientists. Perhaps in some alternate universe where Linda's diagnosis was not performed so smoothly, her diagnosis may not have been delivered in a suitable timescale, or maybe not at all. Had her sample been mixed up with others, a false diagnosis of something more serious may have been made. Mistakes such as these, while uncommon, happen in a very small percentage of tests carried out. But due to the sheer volume of tests carried out daily, a certain number of mistakes are inevitable. We have 3 proposals in order to produce the most efficient, cost-effective and patient-forward approach to pathology to minimize the frequency of these mistakes. Firstly, we aim to introduce a national pathology network rather than a series of small, regionally based ones. In addition to the network, we feel as though a national database is also necessary in order to achieve our aims. The network and database would act as a hub to all baseline results and benchmarks so that they could be nationally regulated and standardized. In regards to regulation, we hope to also include all standardized procedures of conduct in order to make the pathology network as patient-focused and friendly as possible, which is one of the NHS's principal values. Building and using the network to its fullest, a sample collection vials with engraved barcodes or identification numbers would be introduced. These vials would be easily traceable, reducing loss of samples, as well as being able to log the whereabouts of the sample after every step. For example, the sample will be logged when first taken. Instructions for tests could be logged, as well as patient name and NHS number. Following on from this, all samples that were to be transported could be collated in a box and scanned by the delivery person. Not only would this reduce the risk of loss during transport, but it would also lead to a stable chain of contact with the samples. The next person to look the sample would be the pathology lab, and scanning of the vial would be necessary after every test taken in order to ensure no mishaps, such as confusing two vials for each other, as, after all blood is red in the tube. Another addition to pathology that should be made is the use of an algorithm such as PRIMS, in order to make a delivery and pickup route as efficient both in terms of money and time as possible. This logistically would be better for the pathology service, the driver and the patient. Our final addition to the service would be a comprehensive end-to-end IT system, ensuring that the network is available to access every step of the way. Science has developed majorly since the ancient Egyptians trying to cure illnesses by appeasing the gods, and so has pathology. Identifying causes has always been pivotal to the process. However, as time moves forward, so does technology, and as a society, we're no longer living in the Dark Age. A comprehensive national pathology network is the key to cracking the code of achieving both efficacy and efficiency, as well as sticking with the NHS's code of conduct, making the patient the priority. Because of the magnitude of the effect that pathology and lab results have on the patient, it is fundamental to get the process as perfect as possible by not only employing new techniques and technology, but basic technology as well. Due to our wide and detailed analysis of current pathology procedures, we feel as though our proposals would ensure that every patient's pathology journey would be as smooth as Linda's.